Um, Good afternoon. I am Neil Villarin, and this will be my final demonstration for the um, SS-103 First Aid class under Sir Albert. And I am tasked to demonstrate three scenarios. First, a second-degree burn at the jaw. The second is a first-degree burn at the tibia. And on the last part, I will be demonstrating how to apply first aid on a compound fracture on the left metatarsal. So, when we say burn, it can be categorized into 3 degrees. First degree is that the burn had affected just the surface of the skin, to which it is noticeable with a redness or a spot within the top layer of the skin. The second degree is that there is a blister, a water that is entrapped by a thin layer of skin can be noticed. And the third degree burn, which is the worst type of it, to which there is this destruction of the skin, and that on worst scenario there could be blackening or dark spot within the wound. Also, there are types of burn that can be attributed or can be caused by flame, by chemicals, by heat wave, to which due to extreme heat, one has touched, be it a stone or any parts, conductor of heat, and due to unexpected instances, nagunita nila and that caused his or her hand to get burned. Also, the sunburn itself can be, or the most common cause of first degree and second degree burn. Also, the categorization of these degrees, the first degree and the second degree burns can be attributed to be a minor one, and the major is a third degree burn. Minor one can be treated alone at the home and no need for a paramedic or a doctor's intervention. However, if the surface area of the burn had reached up to 5%, we can call for emergency. 1% is equivalent to the palm of your hand, excluding the fingers, so this part. So this is 1%, 2%, 3%, 4, and 5, for example. If the surface area of the burn comes onto that large surface area, then it calls for emergency. So now, I will be demonstrating to you a second degree burn on the jaw area of a 23 to 26-year-old young lady here. Sure.
Kanila or only?
Go. So now, we can see that the lady is cooking something, probably frying, and all of a sudden, nabiksan siya sa mantika. Nabisik ang mantika, unayos yan na. So,
Aray!
here, we can notice that the lady had acquired a second degree burn attributed by some blisters inside the redness of her jaw part. So now, we will be administering first aid for the lady. Okay. So, when administering first aid on burn, we should remember 3 things. 3 C's. First is cool, that's C-O-O-L. Second is C-A-L-L, or calm. And the third one is cover. So now, I will be letting the woman, the lady, to get her burnt area direct tap water in order for her to feel ease with the burnt area. Okay lang ba na? Pagasin na tayo imong paso ha? Kaya para okay. Sige daw, pagasin lang daw. Dali siya sa nang. Pagas, ana. Very good. Nice one. So now, we can see that the lady is letting the tap water flow into her face. And we will allow her to do this for the next 20 minutes. Sis, kung sa'yo na-feel niyo, masakit ba kayo?
Sakit gihapon.
Sige daw, kung i-rate daw ni mo 1 to 5. 1 kay okay lang. 5 kay sakit jud kayo. Unsa man jud? 5 jud. Sige, relax na na. Padayon na lang na for the next 20 minutes of okay lang ka. Obserbahan lang natin na ay kabala ka, dili ta kapasagdan ha. Ko lang sis, padayon na. Go. Shocks na. And now, go. So now, we will re-evaluate after 20 minutes what the patient is feeling. Kamusta man? Sige, tawagin ako.
Gihapon.
I see, sige. So now, since the patient is feeling extreme pain still, I will be asking one of our housemates here to call for 911. Yeah, pwede ba ka makatawag 911? Kaya napasok din si Joy. Sakit daw gihapon kaayo. Alright. Sige. Papaabot lang ni Derek. So for now, sis, kung sakit mo dyan gihapon kayo siya, no? Nakuha ano Derek? Natay aloe vera na non-stick gauze. Or on some, when available, there are a kit we call burn kit na naa siya a sterile gauze that has a coolant gel on its own. And as a substitute, we have here a non-stick or a non-cotton material filled with jelly that would certainly give an ease to the burnt area. Ibutang ito ha? Sige, ganito lang kami. Very good. Nice. Padayan lang na siya ha? So, we will wait, while waiting for the paramedics, we secured that there will be a continuous coolant on the burn area. The purpose of this is that first, it reduces the pain of the patient. Also, it reduces the swelling of the burned area. Also the tap water helps us to clean the wound. It also improves healing and it lessens the scar while the wound is healing. So while we are waiting for the paramedics, since the pain is still continuous, we will secure that the blister will not be contaminated. So gladly that we have this sterile gauze with gel as a coolant, but when unavailable, we have something in our kitchen that we can use as a substitute. So we have here a cling film. Muna siyang ginagamit natin usually kung mga saita, mga bring home pag na birthday. And we can certainly use this to be the cover, the third C of the 3 C's. The cover to prevent contamination. Make sure that it is the clean portion of our cling film. So I will be getting some of this. Since only the jaw part is the affected area, I can get some. Pwede tanggalan mo. Nice one. Great. And I will be loosely putting the clean film on the affected area. This one. Nice one. And we can have another one. Sakit, di hapon kayo, no? Sige na lang, ha? Relax na. Okay lang siya. So that is how we, I just got notified that the paramedics are already outside. And that is how we administer first aid. But it is also a good thing that we should know that once a second degree burn happen, do not pop the blister because it will just allow more and more room for contamination on the burn area. So this is Neil Villarin together with my great artist Joy saying thank you and goodbye. Bye for now. Go. Thank you sis. Napaisa.